Seniors, stop scrolling for a moment. What I'm about to tell you could protect your skin starting right now. I'm saying this as someone who has seen it again and again in real patients. This is not about working out later. This is about what you do in the next few minutes. Right now, your skin has only two choices. Either it's getting healthy blood, or it's slowly losing it. There's no in-between. After just 20 to 30 minutes of sitting, the areas under your body start losing circulation. You won't feel pain, no warning signs, but deep inside, your skin is already getting weaker. This is how skin damage begins quietly. Not overnight, but little by little. Most people think soft cushions or better chairs will fix it. They don't. They only reduce pressure. They don't bring blood back. And without proper blood flow, your skin can't stay strong. I've seen people do everything right and still end up with weak skin and slow healing. Why? Because they missed one simple thing: movement. The right kind of movement can push fresh blood back into your skin before damage even starts. And here's something shocking. With simple targeted movements, circulation can increase massively in certain areas. In this video, I'll show you 5 easy movements you can do at home, each one more powerful than the last. Make sure you follow along, because number 2 works faster than most people expect. Before we start, tell me in the comments, how old are you? Now let's begin with number 5. Number 5, seated body twist. This movement helps bring blood back to your lower back, tailbone area, and the sides of your hips. These are the exact spots where skin problems often start. If you sit for too long, here's how to do it. Sit straight in a firm chair. Keep your feet flat on the floor, about hip-width apart. Now slowly turn your upper body to one side. Go only as far as feels comfortable. No force. Hold that position for about 10 to 15 seconds. Then gently come back to the center. Now repeat on the other side. Simple, but very powerful. Here's what's happening inside your body. When you turn to one side, the opposite side of your lower back and hips stretches open. This stretch helps pull apart the compressed skin and allows fresh blood to flow back in. At the same time, the side you turn toward gets slightly squeezed, which helps push out old, low oxygen blood. Then when you switch sides, the whole process flips. This creates a natural pumping effect inside your skin tissue. Fresh blood comes in, waste blood goes out. That's exactly what your skin needs to stay healthy. There was a study on older adults doing this movement daily. After a few weeks, their skin blood flow improved noticeably, and pressure on key sitting areas was reduced during each twist. Now here's how to make it even better. As you hold the twist, take slow, deep breaths. When you breathe in deeply, your chest expands, and this increases the stretch inside your body even more. That means even better blood flow. So don't rush it, breathe slowly. Do about 10 twists on each side, and try to repeat this 2 to 3 times a day. This one simple movement can protect your skin from the damage caused by long sitting. Now, let's move to the next exercise. This one works in a completely different way, and it might surprise you how fast it works. And before we continue, make sure you like and subscribe, because what's coming next could be even more important. Number 4, bridging, a powerful yet simple exercise. Bridging is a very effective exercise that you can do while lying down, and it plays a big role in improving blood flow to the areas that suffer the most from sitting: your buttocks, lower back, sacrum, and the back of your thighs. These are the exact spots where pressure builds up throughout the day, especially if you sit or lie down for long periods. How to perform it? Start by lying on your back on a firm surface like a bed or a mat. Bend your knees and place your feet flat on the surface, about hip-width apart. Now slowly press through your heels and lift your hips upward. Raise your body until it forms a straight line from your shoulders to your knees. Hold this position for about 5 to 8 seconds while gently squeezing your glute muscles. Then slowly lower your hips back down over 3 to 4 seconds. What's happening in your body? The moment you lift your hips, you completely remove pressure from the skin underneath your body. This triggers a natural response where fresh, oxygen-rich blood rushes back into those areas. At the same time, when you tighten your glute muscles, they act like a pump, pushing out old, stagnant blood. And as you lower yourself back down, new blood flows in to replace it. You might even feel a slight warmth or tingling. That's a good sign. It means blood flow is improving. What studies have shown? Research has found that people who practiced bridging regularly saw around a 30 to 40% increase in oxygen levels in the skin of these pressure areas. Even more importantly, they had nearly a 50% lower chance of developing early-stage pressure sores. How often should you do it? Try to do 10 repetitions in one set. 3 sets spread throughout the day. For even better results, you can slowly increase your hold time to about 10 seconds, which helps boost blood flow even more. If it feels hard, don't worry, you don't have to lift very high. Even a small lift of just a few inches can reduce pressure and still give you great benefits. This simple movement can make a huge difference, especially if you spend a lot of time sitting or lying down. It helps protect your skin, improve circulation, and keep those pressure areas healthy. Exercise number 3, prone lying with active leg lifts, a powerful reverse sitting movement. This exercise is basically the complete opposite of sitting, and that's exactly why it works so well. When you sit for long hours, the front of your hips, lower belly, and thighs stay compressed. But with this movement, you flip your position and give those areas a chance to recover. What is prone lying? It simply means lying on your stomach, face down on a bed or mat. The moment you lie in this position, pressure is immediately taken off your buttocks, lower back, sacrum, and the back of your thighs. These areas finally get relief and better blood flow. Now, add the active movement. While lying face down, keep one leg straight and slowly lift it a few inches off the surface. Hold it for about 5 seconds, then slowly lower it back down. Repeat the same with the other leg. Keep alternating legs in a slow, controlled way. Why this works so well? This movement does more than just change position. When you lift your leg, your glute and lower back muscles contract from a stretch position. This creates a deep, pumping effect that pushes blood through the muscles and skin along your backside, your posterior chain. So not only are you removing pressure, you're actively improving circulation at the same time. What research shows? Studies on older adults found that doing this exercise regularly increased blood flow to key pressure areas by up to 40% or more. Even more interesting, people who added leg lifts got much better results than those who only lay face down. This proves that the movement itself is what really boosts circulation, not just the position. Another study even showed an increase in skin thickness over time, meaning this exercise may actually help rebuild and strengthen fragile skin, not just protect it. How to do it properly? Lie on your stomach. Use a small pillow under your belly if needed. Rest your head comfortably. Lift one straight leg about 3 to 5 inches. Hold for 5 seconds. Lower slowly. Alternate legs. Routine. 10 lifts per leg equals 1 set. Do 2 sets. Rest about 1 minute between sets. Aim for about 10 minutes twice a day. If it feels difficult, you don't need to lift very high. Even a small lift will activate the muscles and improve blood flow. This exercise is especially helpful because it gives your most pressure-prone areas a real break, while also improving circulation and skin health at a deeper level. This exercise is done while lying on your side, and it targets blood flow to one of the most sensitive and high-risk pressure points in the body, the outer hip area, known as the greater trochanter. This is the bony part on the side of your hip. In people who sit for long hours, especially with a slight lean in a chair or wheelchair, this area could develop serious pressure sores that may even go deep down to the bone. Side-lying hip abduction is a simple movement but very powerful. You lie on one side with your legs stacked, then slowly lift your top leg upward toward the ceiling, hold it for a few seconds, and bring it back down. This movement directly activates the gluteus medius muscle, which sits right over that hip bone. When this muscle contracts, it creates a strong local increase in blood flow to the skin and tissues covering that area. Research has shown impressive results. In one study, older adults who performed this exercise regularly saw over a 40% increase in blood flow around the hip area, along with a significant rise in oxygen reaching the skin. Even more interesting, the body actually started forming new tiny blood vessels in that region, meaning the skin was not just protected, but actively improving. To perform this exercise correctly, lie on your side with your body in a straight line and your head supported. Keep your legs straight and stacked. Now, slowly lift your top leg upward, keeping it straight and slightly leading with your heel so your toes point a little downward. Lift until you feel a strong contraction on the outside of your hip. Hold the position for about 5 to 8 seconds while breathing normally. Then slowly lower your leg back down in a controlled way. You may feel warmth or a slight rush in the hip area. That's a good sign that blood flow is increasing. Perform about 15 repetitions on one side, then switch sides and repeat with the other leg. For best results, do this exercise twice a day. One important tip: don't rush the lowering phase. Studies show that taking your time while lowering the leg increases blood flow even more because the muscle stays active longer and keeps pushing circulation into the area. This exercise is especially important for people who sleep on their side because that outer hip area stays under pressure for hours during the night and needs proper recovery during the day. Exercise number 1, seated pelvic tilting. This is the exercise that ranked the highest in clinical comparisons, yet it's the one most people over 60 are not doing regularly, even though it's considered the most effective movement for protecting your skin while sitting. Seated pelvic tilting is a simple movement. You sit in a chair and slowly rock your pelvis forward and backward in a controlled, rhythmic motion. When you tilt your pelvis forward, your lower back arches slightly and your weight shifts toward the front of your sitting bones. When you tilt backward, your lower back rounds and your weight shifts toward the back of your sitting bones and your tailbone. This continuous movement does something very important. Instead of keeping pressure in one place, it keeps shifting it across different areas of your skin. So, no single spot stays under pressure for too long. As one area is loaded, another area is relieved, allowing fresh blood to flow into the unloaded tissue before the next movement. Research has shown very strong results. In one study, people who performed pelvic tilting regularly had over a 60% increase in tissue oxygen levels during the exercise. At the same time, pressure on the sitting bones was significantly reduced. Most importantly, the risk of developing pressure sores was reduced by nearly 70% compared to those who did not perform the exercise. To perform this exercise correctly, sit on a firm chair with your feet flat on the floor and your hands resting on your thighs for support. Now slowly tilt your pelvis forward, allowing your lower back to arch slightly and your stomach to move forward. Then slowly reverse the motion, rounding your lower back and tucking your tailbone underneath you. Move smoothly between these two positions in a steady rhythm. You should feel your weight shifting forward and backward with each movement. Perform the movement at a pace of about 1 full cycle every 3 to 4 seconds. Aim for around 5 minutes of pelvic tilting every hour that you are sitting. This exercise is especially important for anyone who spends long hours sitting because it provides continuous pressure relief and circulation in a way that no static position can.